Good morning, everyone. Welcome to the February 27th, 2023 meeting of the Whatcom County Incarceration Prevention and Reduction Task Force. I'm Stephen Gockley, co-chair, along with my fellow co-chair, Jack Hovenier. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people, who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So I'll call the meeting to order. Jill, can you just scroll up a bit on the agenda? Thank you. I'm going to turn it over to my co-chair, Jack Hovenier, to introduce Councilmember Barry Buchanan.
Thank you, Stephen. Barry, you likely need no introduction here, but what Barry's going to lead us in now is a discussion on an update, particularly on the needs assessment, and also noting that the task force this morning is also acting as a law justice council as we review this information. I think Barry, you're going to go over the amendments, which is obviously the agenda, as well as the next steps to council. And with that, Barry, it's all yours, and then we'll have discussion following.
Thanks, Jack, and thanks, Stephen. Good morning, everybody. It's been a long process, but we did come to a conclusion, as you know, with the needs assessment report that was generated by the work of the Stakeholder Advisory Committee. And this body looked at that last month, and we endorsed it kind of with that provision to come back and look at those amendments that were outstanding on the document that we had reviewed. Just to give you a little catch up on what's happened since then, the council voted 7-0 to accept the report. The SAC itself did vote in favor of putting the report forward. And Jill is going to put up those amendments that did pass, so you can see kind of where we landed. I think there was 5 or so amendments, or maybe more, but only 3 got through the process. So Jill, if you could put that up, that'd be great.
Thank you. Can you see the first amendment that is hopefully should be on your screen with the highlighted information?
I can see it, yeah. So the first one was just to select a location for the jail with due consideration to the comparative importance assigned to proximity and various resources and services. And as you can see, there's the rationale. There was some discussion that we had here. Bill had a concern, but the amendment did end up passing. So the next one was.
Give me 1 minute to scroll to it.
Sure.
There it is.
To add a new bullet to need C1, sized and operated to assure booking restrictions in the county and its cities will not occur. So that was just to make sure that we are planning for not getting into the same situation we are right now. So that amendment also passed.
And this is the third.
I'm trying to see the text.
It's highlighted where it says explore and develop outpatient.
Oh, okay, that's it. Explore and develop outpatient competency restoration services. That's something that we are definitely looking at in the county as well. There's a lot of discussion around that. That amendment also passed to keep that, on our radar. And that was the 3, right, Jill?
Yep, that's the 3.
The one that had the most concern out of this group was some of that oversight amendment that was put forward that we weren't all that happy about. That did not pass. So that's what you have. So our endorsement at this point stands including those 3 amendments, unless this group, we gave this group the opportunity to rescind that endorsement should we want to. So I would offer, if anyone has a problem with those 3 amendments that we pretty much head nodded to last month, please speak now. Okay, Jill, I will assume then our endorsement of the process stands. And I'll kind of go into this part 2 of my report today. That kind of covers the past. The resolution that the county council considered last week included a couple of whereases and a couple actually, therefore be it resolved, about the task force's involvement as the Law and Justice Council moving forward. And what that means is, as you can see, a number of you have been sent invitations to the workshops that are going to be taking place next month in March. There's 4 in March and 1 in April, so a total of 5. They'll be fast and furious. Once a week, they're going to occur to discuss the various segments of the needs assessment report, which are systems, services. Facilities is broken into more than 1 workshop because of the complexities, and then funding will be the last one in April. Also, there'll be some check-ins along the way with the Law and Justice Council as we get some milestones, and then we'll also check in with the council as well when those milestones, when we are making those report outs. So that the month of March will be spent with the, like I said, the workshops. And then the month of April will be kind of validating the work of that workshops with some focus groups that go out to some of our more marginalized folks out in the county. We're going to be approaching, the BIPOC community and certainly those that have been formerly incarcerated and their families. So we're keeping that same audience that we tried to reach out to with the VITA company when we were doing the outreach portion for the needs assessment report. And we're going to follow up on that same strategy with kind of the validation of our implementation plan as we create it. So that is a lot, I know, but that's kind of what's going on right now, with a target of the first meeting of June to be able to present an ordinance to the council to place something on the November 2023 ballot. So questions? Dan?
Yep.
Thanks, Barry, for that report out. How is location, size, and cost determined for the ordinance?
Well, that's going to be part of the work of the workshops. That's the next phase, is to take those kind of guiding principles that came out of the needs assessment report and put that into on the ground, both projects and system changes and all the things that we want to see in a new facility, with our numerous a lot of behavioral health support and SUD support. So Tyler?
Oh yeah, thanks, Barry. I was just going to add, as well, as the workshop for facilities is broken up into 2. So workshop number 3 is facilities, community-based facilities and housing, behavioral health services, etc. And then workshop number 4 is the facilities discussion, kind of specifically surrounding the jail and accessory services. So really spending enough time and effort to have conversations on both of those. And Councilmember Hamel, to your question about really identifying and selecting sites and understanding costs associated with it, I think it's been very important from County Council in the last couple of conversations, and Councilmember Buchanan, you can speak a little bit more to that as well.
Yeah, the comments that we did get on the needs assessment report was, we really hope that the implementation plan will give us clarity on both capacity, size, and location. So that's something that the implementation team is taking very seriously and is going to wrap that into the work that we do over the next few months. So other questions? Tyler?
Oh, yeah, I was just gonna point to, I believe most task force members that were going to be participating in the upcoming workshops have received emails from Kathy Hulka in regards to kind of the next step and the worksheets that are going to be developed. That's really going to be the documentation and information that we're going to be building off of the needs assessment report, in which it walks through and recognizes needs and recommendations. From there, what we're trying to determine is actual implementation actions. And the planning team has kind of developed a worksheet that we want to utilize to be able to ferret out that information. So anyone that's, all of us that are participating on the work group coming up, the workshops coming up, I really ask that you guys focus your attention to the worksheets that are being sent out, because that'll be a really good vehicle for us to get the information out that we're looking for.
Thanks, Tyler. Yeah, I did mention though that the task force was getting those invitations, but it is important to fill out those worksheets, because that's how we're gonna get the information. Dan?
Yeah, so we have some data from the GRACE and the LEAD programs, and we have some very early preliminary data from the alternate response program that the city of Bellingham has put forward and has implemented. I'm just wondering what other behavioral health programs and resources will be made available to the work group to, and I'm thinking like, MCOT and PACT, and perhaps, I don't know, other private resources like Lake Whatcom Treatment Center. How will those resources be able to inform the work group when they're making their recommendations as to the size of the new facility and to some extent to the location?
So I see Perry, you have your hand up. Are you going to take a shot at answering that? Okay, go ahead, Perry.
Good morning, Perry Mowry, Health and Community Services. We did get I got the invitations from Kathy, and she had also asked about representation from the behavioral health providers that Councilman Hamel had made a reference to. And we gave Kathy names of those individuals to invite to those workshops as well. So that there could be, that information could be provided and et cetera. I've been off this past week, so I'm not sure about whether those were accepted or not, but I did impress upon those behavioral health providers the importance of representation from their facilities and this input. So just wanted to share that.
Other questions? Seth?
Barry, apologies if you've laid this out already, but I just have I want to understand better the process by which the implementation plan work gets blessed and approved. Who's the staff that works on that? And is there a role for SAC or Incarceration Prevention Task Force to review and offer recommendations on that implementation plan before it goes to council?
Yeah, Seth, the workshops that I mentioned are going to be formulating the steps as we go along, and we're going to do check-ins with both this group, the Incarceration Prevention Task Force, and the council as we go along and receive input. We're not just going to lay something out, at the 11th hour. Here's what we're giving to council. So we're going to be looking for input from the task force as the Law and Justice Council. Probably every month, I would think, as we move along.
And is the SAC's work officially done?
Yes, but many of the members of SAC are also going to be participating in the workshops.
Okay, thank you.
The list is long of people participating.
Can I just say, just to clarify for everyone, that the workshops are formally a special meeting of the full task force. So all the task force members are invited to attend.
Yeah, good point.
Thank
That's how we're noticing it, because it seemed the best way to capture a quorum. The quorum issue was that way. Chief Mertzig,
Are we able to send a proxy if we can't make any of those workshops but want to? Can we send someone on our behalf?
yes, it'd be or a designee, yes.
Thank you.
Dan?
So I'm still trying to get my head around the process for determining the size of the jail, which was met with some, opposition the last couple of times that the levies were conducted. And I guess I just don't understand how a group of how the SAC has any specific expertise in determining what that is going to look like, and how that this is, if this is passed, this is a facility that will live on for 50 years or more. And how, so my question, I guess, is how does the SAC then become informed on the best practices around determining size of the facility in relation to the behavioral health services, both pre and post incarceration, that would potentially benefit the people that are justice involved? I guess I'm not really clear on that. I'm hoping that someone here on the call will have an answer for that.
Tyler, do you have some clarification around, how we get to a capacity?
I mean, sure, there's been lots of different conversations surrounding it. I see Lieutenant Erickson's on the call as well. And so, in the past, there's been experts brought in, and I know we don't always like to look backwards, we like to look forwards, so I understand that. In that effort, what we did is looked at jail numbers, admission causes, different factors as it relates to state, local decision-making and crimes associated with it. And then also behavioral health inputs and where it goes. So those give recommendations in regards to size or number of beds. I assume, Councilmember Hamel, you're asking how many beds is the new facility going to have? During those processes, there usually becomes a range of beds associated with the facility. I think there has been an ample amount of work done on that. I think your question about how does the new services like behavioral health inputs from GRACE and LEAD and alternative response affect those numbers is a good question. I think we'll need to do some good thought on that. And I implore the task force to really start to think about how to factor that into the decision making. But I do think that there's enough information and enough data to make a range decision to inform the council, the county council, to make a decision about how big, how many beds there could be in a range associated with a facility. I think the most important, another very important part is what services do we want in that facility? Not specifically just the number of beds, but what type of beds? Should we have more medical beds? Should we have more behavioral health beds? Should we have a right door so that people don't go and be incarcerated, but they're actually have some criminal action and they need some services at that location? And let's talk through those services and not specifically and maybe get bogged down to exactly the number of beds, but talk about a range associated with it and then the services surrounding it. But there's some time between now and the workshop, and I see other people have some input on it. But that's my initial thought to the question.
Thanks, Tyler. Mayor Korthai.
Yeah, I guess I was going to pipe in as well that, as Dan mentioned, this is a facility for the next 50 years. I guess what I'm envisioning is a size for today, but expandable in the future if it's needed. And only time will tell if that's the case. So our location in my mind, has to be able to handle the needs of Whatcom County for the next 50+ years. So let's not hem ourselves in on size today in a location that won't allow it to expand if needed. The other thing I wanted to say is the child care initiative passed recently with not much information about what things were going to look like once the money was approved. And I guess that should be a discussion maybe with this group or some group is, do we want to just say, hey, we need a jail? I guess in kind of layman's term, and trust us, you give us the money, we'll take care of it. Or do we want to get down into the gory details? We need a jail. It's going to be this size. It's going to be located here. And then some people can just pick on one little detail they don't like and vote against it, as opposed to if we get general approval and then go out and build a jail where the smart people in our county can come together and say, this is what we need and this is where it ought to be. Anyway, those are two things I've been thinking about as we move forward.
Raylene?
Thank you. I believe all of the points made were well thought out, and I think the restrictions was something that was brought up in the earlier conversation on that we don't want to have jail restrictions in the future. And I think as we're also looking at treatment and reentry and all of the other aspects that need to come into it, we also have to think about the liability that we currently have with our current facilities as we look to increase the size of individuals that are supposed to be held for a judge that aren't being held for a judge because we don't have the space. As I look at the jail roster this morning, it's not DWS thirds, it's robbery, it's assault, it's another robbery, it's burglary, it's arson. We're looking at very serious offenses. And then we think maybe the misdemeanors aren't, but those misdemeanors aren't necessarily being held, and the safety of the community is also a concern. And so I just want to make sure that we don't forget about the liability that the county is incurring now, and we don't want to see that in the future. Thank you.
Jack?
Like a lot of you have thought about this too, and Scott or Mayor Cordice captured a lot of my thoughts. That you have to envision what do we need for 40 or 50 years from now. We're not building exactly for today. I liked and I also like, for me personally, and some of you may feel differently, I like the idea of not picking an exact size and exact location as part of the ballot initiative, because I believe information will be forthcoming that will help us determine that we may not have in time. And in previous ballot initiatives, I think one of the challenges was the specificity. Absolutely, we need a range. We know the current jail is in poor condition, it is over capacity, and we have booking restrictions. We're aware of that. We can also be hopeful that I'm hopeful that things like scram bracelets and other technologies may alleviate the burdens on the system as time goes forward. We don't know what resources we'll have in 10 or 20 years, or even 5. So, and we also, I'm not sure, Lieutenant Erickson, but it didn't feel to me like the old jail was designed to have 2 beds in each cell. We just kind of added them in, right? But so we could create a facility. A best practice generally is for people to have their own space and get a tank or whatever. We could design a facility, maybe a little slightly bigger rooms that you knew if you had to, well, you can double capacity this way. You can, through segregation and demographic of inmates, have people that are more likely not to be violent with each other. And I mean, there are things we can do to thoughtfully address the need to increase capacity that may not be as onerous as we think. And I'm not sure all of that will be sorted out by the ballot initiative in June. So I kind of favor the idea of, we know we need something. We know what some of our best practices are. We know we need a range. We know we need to not have liability. And we know we need to be able to meet the needs that we currently have as well. So those are some of the thoughts I have around this. Thanks.
Lieutenant Erickson?
Thank you for hearing me. So a couple of things as we talk about capacity and design and things like that. If you think about in terms of, hey, we're going to build today 100 beds, but we want to have the ability to have an additional 100 beds at some point in the future. all of the services that are associated with those beds need to be commensurately increased now for the potential in the future. Meaning, so you have plumbing and sewer pipes that have to be built so that they can accomplish the same needs, but at twice the capacity. You have to have HVAC concerns, kitchen and laundry services. So all of the services themselves need to be built in such a way that if we do want to increase capacity at a future time, we don't also have to go back and increase some of the infrastructure for those services. Just something to point out.
Couldn't find my unmute. Thank you, Caleb. Anybody else? Well, thanks for all your work on this. Y'all have been in this project with us through all our various meetings and workshops throughout the past over a year now. And we will brief you again next month. Thanks.
Thank you, Barry. And Stephen, I'm going to turn it over to you for the next agenda item, the legislative priorities for state representatives. I think that's you and Mike Parker. So if you'd like to take that.
Thank you, Jack. Mike, I'd like to call on you, if you don't mind, to sort of frame or update the task force on the discussions that have gone on some of the legislative wish list, which is morphed considerably into a broader set of discussions, I think. And I'll be glad to fill in as you wish.
Super, thanks. So as the task force probably recalls, we brought this up a couple of times, and this stemmed from an October meeting with Representative Alicia Rule. As Stephen mentioned, it expanded out. We ended up talking to all of the representatives in the 46th and our newly elected state senator, Shoemake. What we were essentially doing, as we've mentioned before, is bringing concerns, ideas, project ideas, wish list items about behavioral health challenges. Obviously, one of our goals, Stephen, myself, and Brian Estes from the Behavioral Health Subcommittee, we're meeting with representatives, really seeking, one, to educate and wanting to kind of share some of the work of the task force, some of the hope and promise we have in the task force, talk about diversion alternatives and what legislative pieces could be helpful. One of the things that we realized in our own subcommittee is there are certain things that we need state assistance for. We may need funding for various things, and we may need policy pieces. So that was kind of the gist about why we went to those folks. We did a first line of meetings, and then after meeting with Tyler and some folks in the exec's office, we got some more information, which made our second round of meetings much more toothsome, very productive, I would say. And in so doing, that conversation with the execs was a great kind of alignment. We could kind of see, what are the things that the county council is wanting to advocate for? What are the alignment parts between the task force members and the council? And I think that second round of meetings was made even stronger because we had that alignment. We were able to get from Deputy Executive Schroeder, lots of the behavioral health pieces that started to take shape. It's a very quick and changing time during the legislative season. So what we found is our requests got really honed and more aligned with the county. And I'll just briefly recap them. So one of the things we were talking about was competency evaluation. You can see that was put down as a really crucial part from the SAC. There's a small work group. Stephen, I'll let somebody else talk about the work group and its activities, but is looking at outpatient competency restoration. We wanted our representatives to understand how challenging that is and how impactful that is on our jail and our capacity, and the lack of the state's follow through on True Blood, right? So this is part of our education piece. The other thing that we brought forth was reimbursement rates to our workforce. I mean, everybody in criminal legal system and behavioral health has seen the challenges in our workforce. And so we advocated on behalf that they look at that and increase those rates. Another thing we wanted is to deal with some of our prescriptive ability in the jail. We hear concerns and challenges about how difficult it is to get prescribing assistance for people in the jail, and how many people are in our jail that need behavioral health treatment and or medications to make their stay more comfortable and to help them to stay competent. Obviously, we'd have severe challenges in that area. So those were our really large pieces. And then I would add at the end, after our alignment meeting with the exec's office, where we're able to champion a couple of proviso requests that are really getting at like studying some particular pieces, you know, behavioral health facility and an SUD treatment facility. So I want to just shout out to the exec's office for the leadership regarding getting some of those requests in into a very busy season. And I would characterize, Stephen, and I'll let you finish, and if you had anything to add, but I would characterize the meetings as productive, with mutual respect. I think they're interested in the task force. We asked at the end of the meetings if they would care to join us at a task force meeting to kind of get a sense of what we're wrestling with here, you know, the collaborative nature, but also the challenges and how they might be instrumental and useful to us as we go through this process. So Stephen, I'll stop there, and certainly if you've got some to kind of add in or fill in, and I'm happy to take any questions in that.
Thank you, Mike. I think the one thing that, and correct me if I'm wrong, that I didn't hear was the priority to resolve the operating funding for the Ann Deacon Center for Hope, the Crisis Stabilization Center. We promoted the idea of what Ann Deacon herself came to call a firehouse model, which had been floated in the session also. It turns out it's much more difficult than we thought to get a handle on the totality of the funding for the Crisis Stabilization Center. And I want to thank Perry for all the help he's lent this legislative work, filling in some details that our elected representatives were interested in and really needed to understand. This one is still a little bit of a conundrum because a lot of the funding, which has been in the form of biennium to biennium budget provisos, was run through the North Sound Behavioral Health Administrative Services Organization, the ASO. So we haven't been completely privy to that information. Perry has been digging it out bit by bit, but I think there's some clarity that we'll be looking for in the coming year on that, so that we can settle that. I think all our legislators understand the value of the firehouse model, which presents a 24/7, 365 availability for crisis stabilization services, not a per unit of direct service kind of reimbursement model that the managed care plans for Medicaid and the ASO itself for non-Medicaid admittees have been using. There was an expectation that the healthcare authority would work and resolve that with the managed care organizations and try to create a better funding model. That doesn't seem to have happened. And so we're going to try to continue even after the session to promote that idea and provide some stability and predictability for the Crisis Stabilization Center. The other thing I'll add is simply that our focus on competency restoration and circumventing the roadblock that we and most counties are facing by the dysfunction at the state level sort of transformed itself into joining, and we appreciate the openness to this, the three of us, Mike, Brian Estes, and I, joining the competency restoration discussions that Barry, Perry, I think Tyler, Maya Lisa, and some others on the task force have been engaging in since earlier this year. So I think we've sort of localized ways to approach the log jams in competency evaluation and competency restoration. That's not to say that we've made concrete progress yet, but there are some ideas and some alternatives being explored. And Barry or Perry or Maya, I guess I'd invite any of you to add some detail to the competency restoration discussions. Barry, I saw your hand up already, so I don't mean to override any other points you were gonna make, but turn it
Yeah,
over.
I'm gonna let Perry talk to the details about the work group, other than that we are now on a regular monthly meeting schedule. I'll say that. What I did want to add is these this coordination on this legislative effort these are also solutions that go to the needs assessment that was done by the SAC. So these are things that are being considered by the implementation team as some things that we can use to leverage and amplify and help. It's not just a ballot measure, it's how we organize our funding and our priorities going forward. So these legislative acts are more tools that go in our toolbox to achieve, what the SAC's needs recommendations are asking for. So I just wanted to bring up that point, as this is also part of an implementation strategy for our justice system in general, which is what the SAC really talks about.
Thank you, Barry. Maya, I saw your camera come on. I don't know if you want to comment.
Hi, good morning. Well, Eric Sigmar and I are meeting to continue talking about a competency diversion program being started in Whatcom County. And we're trying to meet with some of the King County folks. I know Eric has sent several emails asking for feedback from the prosecutors involved in the programs down there. I don't know that he's gotten a response yet. We're also going to be meeting with Kayla in the exec's office to talk about, how can we be creative about maybe getting someone to be a grant writer to help support a program like that in our county. So that work is happening alongside the regular meetings of the competency work group. And we are, and I don't know if Richie's on here. I mean, I don't know if he wants to talk a little bit about our office. My office is approaching the prosecutors on low-level competency cases and asking that they be dismissed, and rather than go through the competency process. I'm kind of trying to track those requests and seeing if they're being granted or not by the prosecutor's office. I haven't seen any yet, but those conversations are happening as well, so that we can remove from the restoration process people charged with lower level nonviolent offenses and reserve for those much needed restoration beds charges that are violent and more serious. So those are some approaches we're trying to take.
Thank you, Maya. And again, those discussions are tracking models that are being explored in other jurisdictions. So, there's a bit of a roadmap there to look at how it fits to Whatcom County. Mike, I see your hand up.
Yeah, I realized I was not just a mess in bringing up the firehouse model, so my apologies. The other coordination we did was not just at the county level, at the city level. So Council Member Hamill was able to host us over at Chambers over for City of Bellingham. We went with Mark Gardner, their legislative analyst, and obviously looking for spots of alignment in terms of what our legislative asks are. It was extremely productive. And again, I think it's really going to fuel more just getting on all on the same page. We're looking at a summer kind of October time to kind of be more purposeful in 2023 heading into the next legislative season. But I just wanted to add, the city was very supportive, and obviously they know because they're in the meetings, and so they're there when those wish list items come up, and we look forward to even a more successful year next year. And obviously we'll report back to this group on what we have. Right, the session is still happening. Cutoff was last Friday for bills with a fiscal note, so things are going to start taking shape. So I would just exhort us all to follow through and invite the legislators once the session is ended, and we can talk about things good and bad that happen in the session, but especially how they'll affect our work and our context. Thanks, Stephen.
Thank you, Mike. Perry, I'll just ask, Barry invited you to make some more comments on the actual competency restoration work group discussions, aside from the sort of the side discussions that Maya was referring to.
Sure, yes, it's actually our next agenda item, Stephen. And so I just compiled a little bit of information for folks to give an overview of our competency restoration work group. We began meeting on a monthly basis back in August 2022. There's representation in the work group at this point of Whatcom County Council, Executive's Office, Public Defender's Office, Prosecutor's Office, the Sheriff's Office, Bellingham City Council, Superior Court, District Court, and obviously IPRTF, as well as housing provider representation and Health and Community Services Department. I think that most folks are pretty aware of the challenges that are going on with the state relative to True Blood, relative to Western and Eastern State Hospital, access to services there relative to evaluation and competency restoration, both inpatient resources and needs, as well as outpatient competency restoration resources. And so that is predominantly what the work group has been focusing on. We talked some in our last meeting too, as Stephen had mentioned that several new members had joined and really kind of talked about and focused in on what exactly is the goal and purpose of this group, trying to specify that some. And there was some discussion. So I offer this as my understanding anyway of that outcome of that discussion in terms of honing down on those goals and purposes. Number one, understanding the challenges Whatcom County is experiencing with competency evaluation and competency restoration in both inpatient and outpatient settings. Those are different approaches and different needs, occurring relative to that. Obviously, tracking current legislation related to inpatient competency evaluation and restoration services. Senate Bill 5440, if folks aren't aware of it, is legislation that is oriented towards counties assuming a greater role in jail competency evaluation and restoration. There are certainly some challenges there in terms of support, funding, responsibility. And also developing legislative communication and ask related to that were referenced earlier. Another goal and purpose of the group is really honing in on understanding and the researching outpatient competency evaluation and restoration programs, and also, as Maya Lisa had made reference, looking at and balancing that with the prosecutorial diversion programs. We've actually had also some of the members have attended meetings relative to, there was actually a presentation, that was given to us by the LINK program, Legal Intervention and Network of Care, that is established in King County, a prosecutorial diversion program. And as Maya Lisa had mentioned, there's some communication that's occurring there, but really understanding the difference of that type of program in comparison to an outpatient competency restoration program. They are different. Outpatient competency restoration programs, at least from my summary, are programs that are oriented towards establishing a competency restoration and returning the individual to the court setting on an outpatient basis, whereas the programs like LINK that are occurring in King County are more oriented towards the behavioral health component of getting the individual the needs, which certainly include housing and prescription resources, PAC type programs, and addressing that individual's behavioral health needs and housing needs and et cetera, as opposed to simply focusing on restoration, competency restoration and return to the court setting. So ultimately determining the necessary components and challenges of providing an in-jail competency evaluation restoration would be another component, and also services that would be effective within Whatcom County relative to outpatient types of services. That's a lot of information in a short period of time, but hopefully was helpful for folks, and certainly willing to answer what questions I can.
So I sort of blurred the lines there on the agenda, but I'd welcome questions either for Mike and I on legislative focuses and discussions, or Perry and Barry and Maya on the particular competency restoration and prosecutorial diversion explorations. Any questions? Any comments? Raylene. You're muted, mate, Raylene.
Thought I hit it, sorry. I think we're gonna be discussing this at the next joint meeting as well with behavioral health, and so that will give us a more in-depth conversation. A lot of this has to do with individuals that are in custody, but we are seeing dismissals from municipal courts on individuals that have been waiting competency evaluations for over a year. And those things, we understand why the dismissal is necessary. Somebody shouldn't have to keep coming to court or be waiting a year to find out we can't get an evaluation or we can't get restoration done. And then those individuals are still confused because they don't really understand what happened. And then they're lost in the system. And then we see them back in the system later on for other charges usually. So we can't just say we're dismissing them because they still get lost in the system and they still need help. But I think we'll be talking about that more in depth at the next meeting. Thanks.
Thank you, Raylene. And just to expand a bit on Raylene's comment, just a reminder that in March 14th, I believe, is the date of the joint Legal and Justice Systems and Behavioral Health Committee meetings. And the presenter at that meeting is Dr. Thomas Kinlan, who has talked to the task force before a couple of years ago on True Blood implementation. I don't recall Dr. Kinlan's exact title, but he's with DSHS and is the manager of their forensic services. So probably a little bit of an awkward Q&A to be had there, but it will be informative and relevant to a lot of what we've been talking about here. There was another hand up that I missed, and I'm sorry. Caleb, was that you?
Stephen, it was me, and you just brought that up. I think that if folks are interested, I agree. It could be a somewhat awkward Q&A. But Dr. Kinlan's Director of Office of Forensic and Mental Health Services presentation on the 14th, it's from 11:30 to 1 o'clock. And boy, if you are available at that time, that could be a really informative meeting, and hopefully some important questions that could be asked just around that. From my perspective, in terms of, I think that most of the folks have seen Director Boven's letter and some of the other information that had been put out there in terms of the recommendations of what counties can be doing, you know, in terms of having an impact and effect in terms of individuals that are incarcerated with significant mental illness. And yet the answers, there's not full answers that are there. So I'm just really hoping that that will be an informative meeting, and just wanted to make reference to it.
Thank you, Perry. Jill, I'm going to ask, you may already have planned this, but when you send out meeting invitations for that meeting and materials, would you direct that to the full task force mailing list, please?
Yes.
Thank you.
Thanks, Steve. I was going to ask the same thing. Thank you.
Yeah. Okay, Jack, I think I'll turn it back to you and let you carry the rest of the agenda as far as you want.
Okay, thank you, Stephen. And I do have the agenda here, Jill. All right. So we are, I believe, so are we at committee updates then? That's what I thought. Okay. So Barry, I'm going to ask you as the chairperson of the steering committee to let us know what's going on there.
All right, thanks, Jack. Steering committee met and discussed a number of things. Of course, the first thing on our every agenda is the Justice Project. So we just kind of covered the same kind of things that we covered at today's meeting. Number 3 is we can talk a little bit more about, because there's been a lot of activity on the communications front. We have a contract with Pyramid in Pyramid Communications to help us both push out some messaging and test some messaging, as well as train us up on how to do some of this work. So Jill is going to be able to talk a bit about some of the details about where we are right now.
Hi, good morning, everyone. Thanks, Barry. Yes, Emily and Sakara, who you all have met through a couple of their presentations to the task force, have concluded the phase of the contract, the message development, and they're starting in with their message testing and launching the initial communications campaign plan, which includes reaching out to our community partners via email. I've got a communications roster of about 200 individuals in the community, excuse me, that we're reaching out to. An update and refresh of the IPRTF web pages. They've also developed a local and a statewide op-eds that are being shopped around right now. And then we've also launched the IPRTF webpage with content that they've developed for us, and also paid digital, some paid boosting of our web Facebook posts that are showing up on Facebook and Instagram. So the campaign has been launched as of Friday, and I woke up today to 80 new subscribers on the IPRTF Facebook page, and getting phone calls already. So it's out there and it's working.
All right, thanks, Jill. So that effort, Tyler, go ahead.
Well, I was just going to compliment the effort. I woke up today to a family member asking me about what the Incarceration Prevention and Reduction Task Force is and what all the good work they're doing. And it was likely because of the boosting on social media. So Jill, I think that's great to hear that you had a bunch of people sign up for it. And it really is kind of getting the good work that we're doing as a task force out into the community.
Well, thanks, Tyler. That's great to hear that it had the kind of outreach it's getting. Perfect.
And Jill, maybe remind people to follow if you're on Facebook. We would really appreciate if members of this task force and subcommittees followed up.
Yeah.
Or followed up, not followed up, sort of followed up, but followed up and following. Yeah, there we go.
One of the other big topics that is still ongoing is the makeup of the steering committee. You know, we talked about, you know, kind of where the steering committee has gone from its inception. It used to be that the really the only role, or the primary and almost exclusive role it had in the early days, was creating agendas for our task force meetings. And we have since kind of moved on to more substantive issues as has been demanded by just our world. And so we're looking at diversity. That was something that really floated to the top of how we're not very diverse on the steering committee, and we could work on that a lot. So that's something that we are going to place at a high priority, as well as the task force membership, I think, as well, as far as that diversity goes. So there'll be a lot more come out on that. We will want input. We will probably create some way to ask some questions of you all to get some of your thoughts and inputs on what you think a steering committee looks like. Let's see. Really, that was everything we talked about. So that's my report, Jack. Thanks.
Thank you. And I just went and followed. So I'll be seeing that stuff too. Anyway, it takes about 30 seconds if you're on Facebook. I think the next committee report is Legal and Justice Systems Committee that met on February 14th. Or who would like to kick that off? Arlene?
I think Arlene had some great notes on this, so if she wants to unmute and do it, and then I'll follow up if there's anything that we need to add.
Yes, it was a very informative meeting. We had Angela Anderson and Jake, is it Webush, reporting. And we talked about the Family Justice Court. We were really anxious to know what's been happening with that court and what kind of results they're seeing. They said that in the first year, there were 18 families that were dealt with in the Family Justice Court. They are required to attend classes and to show compliance, and they're evaluated. This primarily has to do with domestic violence and various high-risk cases. What they're looking for is progress in the sense of people showing a sense of responsibility for their behaviors. So there were treatment reports. There are some dropping of felonies, dropping down of felonies. There was a concern about finding mental health treatment. This is something that we keep bumping into whatever we're doing. There's not enough mental health services available quick enough. So this is just something that is constant problem. The funding for this program is about $20,000 coming from the county and city funds. And the treaters are reimbursed from this funding process. That doesn't seem like a lot of money to me, but that's what's there.
Just to follow,
Yeah.
just to follow up on that, there's no cost in this program to the defendants. And that was kind of an advantage to individuals going to the family court. It's typically a domestic violence charge. There was accountability in the DVMRT program, as well as the POTS program is ran through the Whatcom County Probation Department. And that is why there is no cost to the defendants in this program, which seems to be beneficial because there's not enough treatment providers in the state currently. And this is an opportunity for accountability, and it seems to be working, but because it's so new, we won't get a lot of data until later on. Arlene?
Yeah, so the funding, eliminates the barrier for people who cannot afford the services. So that is really important. The next report we had was from Caleb and from Wendy in regard to the jail. They spoke about the number of re-entry specialists that are needed. They listed the need for 2, and possibly, additional. This has been approved. The need for medication is still a prominent problem. There is a problem also with the slowness of the hearings in court. So people are staying too long in the jails, and then there is a gap between the length of time that they spend in the jail waiting for their hearing and the actual sentence that the person receives.
Thank you, Arlene.
Yeah.
I think when we're saying that there's a slowness in the courts, I think we also have to say it's not always that it's the courts, it's that some of these people are being held up on mental health issues in custody where we're waiting for restoration to begin, and then defense counsel. I mean, it's the vicious cycle that we've been talking about before, that we have to be able to somehow communicate with everybody to see if we can try to expedite some of these individuals that are in custody, because all of the issues are at hand, and it's not just one thing. It could be that they haven't had their competency eval, or that they haven't been restored, and then defense counsel has to start over, and so it's a cycle. Thank you. I think that's pretty much it for legal and justice. Stephen, did we miss anything? Oh,
Sorry. No, that sounded like a good complete report. Thank you both.
Thank you.
Thank you so much, Raylene and Arlene. And finally, we have behavioral health. And I think Dan had to go probably to council. Mike, is that you this morning?
Well, correct on both accounts. Dan had to go to council and it's me, so you get to hear me again. So the Behavioral Health Subcommittee met, we had a robust meeting. We spent the time, as we do, usually the first meeting of the year, we kind of review what did we do in 2022? What is left from our activities as kind of a follow-up, and then what's new for 2023. The membership populates that discussion and really facilitates it. And again, it was a really robust discussion. I'll do just a quick kind of highlight and summaries of kind of what we did. So things that we wanted to recap on is we wanted to hear about some of the current spending and spending priorities in the behavioral health. It used to be the Revenue Advisory Committee. I believe now, Perry, if I'm getting it right, it's the Advisory Committee. Got rid of the revenue part. We'd love to work with them and to kind of check alignment, right? This task force has put in a lot of effort into that behavioral health gap analysis and various types of funding and programs. So we're pretty curious to see how those priorities are lining up, and especially those that bend the arc of incarceration. We talked about the letter that the Behavioral Health Subcommittee wrote to the executive's office. This would have been a couple of years ago, on ARPA funds, and realized that we're overdue and we're as a committee chair to ask for a report on that. So we will be following up with them. So those are just an example of some of the things we looked at 2022. For 2023, we've got a lot of things that we want to focus on. So obviously we've already talked about competency evaluation and restoration and what those promises are. We talked a lot about reentry specialists and that type of work. We were excited and welcome new reentry specialists that the county council approved. And I believe Perry is telling me that we're in the process of hiring. So that is an area of big focus for the behavioral subcommittee. We want to make sure that when people have served their time, that they're met with services that are easy and to avail themselves. So in 2023, we certainly want to look at that. It was brought up by a member that it might be really helpful for law enforcement to have just a quick dashboard on those types of programs, diversion activities with a green light, meaning they are accepting new folks. So we want to, if we want to put our money where our mouth is, we'll have to make sure that people know how to avail themselves of either existing services or new services being created through action. The other thing the committee regularly either hears about and or tracks is new topics, right? So sometimes it's a new drug. Xylazine is making its way out in 2023. We will be looking into the effects of that. And do we need to make any changes locally to know whether we have a problem? For example, if we don't test it, if we have an overdose situation, we may not even know if we have a particular issue. So Behavioral Health Subcommittee regularly studies new trends, tries to get some information, and then if we can, we make some suggestions on how we can better as a community deal with that, both from treatment standpoint, but also what our criminal legal system needs to do. We will, of course, be welcoming an update from Under Sheriff Chadwick on their behavioral health ride-along program. We're excited that they're finally able to get some folks in there, so we're looking forward to that. And also from Chief Mertzig and the alternate response going on in the city of Bellingham. So we'll be actively tracking that in 2023. And I think I hit the big pieces. We're continuing to look at, diversion from narcotic overdoses in the field, and how our EMS and law enforcement can help in those types of situations. So I invite any other task force members, if I've missed a piece, again, I'm just trying to do a high level summary of those items that we covered, and really we'll use those to populate agendas as we go forward in the year. And then we exhorted members to show up. I think this competency restoration that you heard is going to happen in March, our joint, is really interesting, and it's going to focus a lot of attention on this that is popping up in every committee of this task force. So if I had to pick a thing for 2023, I'd say if we could knuckle down and see what we might be able to do as a community to address this particular sticky issue. There was a lot of comments around that particular issue, both from prosecution, from defense, and from our treatment providers joining the call. So with that, I'll stop, and then anybody else add something in that I may have forgotten.
Are there any questions? Thank you, Mike. Thank you for all the information. Stephen, are you aware of anything else, or Joe, anything else that we need to discuss today?
I'm not aware of any other business, Joe.
Jill, do you have any announcements or things for the benefit of the committee that we've either failed to mention or you think should be mentioned?
I do not.
All right, that's like a passing grade. Cool. Lose, pass, no pass. Great. I think then that we are unexpectedly adjourning rather early. I hope that works out well for everybody with their morning.
Jack, we are at public comment.
Oh, yes. Thank you, Barry. I apologize. We are not done. So let me ask Jill to make public comment available. And I can see we have 6 attendees and 2 hands up. So I apologize to the people. Thank you, Barry, for interrupting me, because I can see we have some public comment, and I apologize for not acknowledging that. Jill, I'm going to turn this over to you to facilitate the public comment.
Yes, thank you. You're correct, Jack. We do have a number of attendees today. If any of you would like to speak, please virtually raise your hand now by selecting the raise hand icon or pressing *9 on your phone. When called upon to speak, please unmute your microphone and state your full name. And the first person that I have with hand raised is Michelle Mason. Go ahead, Michelle.
Hi, my name is Michelle Mason, and I'm with FODI, which is Families of the Incarcerated. I'm the Executive Reentry Director. Thank you for having me here today. Just listening to you guys, this is the first one I've been to. It kind of seems like the cart's being put in front of the horse. It sounds like the jail wants to just house individuals as opposed to seeing what the issues are that are getting them there. Is that anything you've thought of instead of a jail, maybe setting up a substance use and mental health facility with that space and money to lower crime rates in the community? Since recidivism rates in the state are fairly high with the lack of programming in jails and correctional facilities throughout the state. Anybody?
Typically, Arlene, go ahead. Stephen, help me remember, typically with public, yeah, we do occasionally, I guess, give some responses. Typically, it's more comment, but sure. Arlene, go ahead.
Yes, if you've been following what we've been doing here, which is really important for you to come bring yourself up to date on what has been discussed and accomplished already, it very much has focused, our discussions have very much focused on what is at the core of the needs in our community regarding behavioral health, mental health services, addiction services. It's very high on our list. It's as important, we all understand that it's as important as anything to do with facility.
Is there anything in the works? I mean, and I do apologize, I just found out about this, so I was excited. Whatcom County is fairly, in my view, progressive, or has the ability to be the progressive entity within our state to change the way our communities are looking currently. So I just feel it's really important to be a part of this.
Well, you know, you're right on that, but definitely read the recommendations that have been put before county. It's on our site, and that will show you all the variety of topics that we've been addressing.
And I will educate myself better on that, but just out of curiosity, on these recommendations that have come to the council, how many of the recommendations have actually gone through? And how many years has it taken for those recommendations to be approved through the council?
Michelle, I'm going to interrupt because that is a long, I think you're referring to the needs assessment from the SAC. First of all, let me say we're really happy you're here and we want to have you involved. I think, though, that probably a conversation with Stephen and I or Arlene or someone might be helpful rather than the whole task force to bring you up to speed on this, if that's okay.
Awesome. So I did drop my email in there.
Cool.
If anyone wants to reach out to me, I'd love to set up a meeting to better educate myself and, you know, be a productive part of this.
Also, not just the task force, but the subcommittees, be that the behavioral health or I always get the legal and that name incorrect. but those are also really good places for these topics. There's not only comment there, but they tend to be a little less formal in my experience as well. So we definitely appreciate having you here. We want your voice at the table. But I think some of those questions are very long answers that we really need to give you some information to address them properly. That's not going to happen easily in a couple of minutes.
Right. Well, awesome. Just, yeah, you've got my email address. I hope. If not, it's pretty simple.
Okay.
FOTI.Michelle with 2 L's at outlook.com.
Okay, and I think Maya has her hand up. Is this related to this, Maya?
Yeah, I just wanted to briefly thank Michelle for being here and for making comment today. And we are looking to include voices of impacted people, and that's something that we're always, I think, challenged to do. So I'm glad that you're speaking up, and Stephen and Jack are really well situated to bring you up to date on the work that we've been doing here for years. And it does touch on the concerns that you're raising. I don't know if I said who I was. I'm from the Public Defender's Office. Anyway, so I'm glad you're here, Michelle, and I hope that you'll participate more in the future.
Yes, thank you for having me.
Okay. We really
I'll
are, Michelle.
close that so others can participate as well.
And
Thank
you heard we're just doing this outreach stuff. So, we're pleased. I don't know if that's what brought you here, but we're trying hard to do outreach, and your presence and your comments are a testament to hopefully that effectiveness or that goal of doing this. So yeah, we'll be in touch, and you can always email the email address. I think it's on the county website, and Jill can forward that to Stephen or I. We can try to connect you with people that can answer your questions and get your input.
Great. I look forward to it.
Thanks.
Michelle, I'll just add my welcome, and Jill, I want to make sure you captured Michelle's email address.
I have, and I've also spoken to, I believe, her colleague who's next up to speak today, and email corresponded with her as well. So
Great.
okay, thank you. So our next person with hand raised is Kaylani. Kaylani, if you want to go ahead and speak.
Hi, everyone. Aloha. My name is Kehalani Walker. I am actually the founder of FOTI, which is Families of the Incarcerated. I am actually now I live in Whatcom County. So I am actually really honored to be in this space with all of you. FOTI is very well growing in Washington. We have formed a Trinity, which is really growing. We have over 10,000 families that are part of our platform. And I actually, Michelle and I are very involved with prison. I'm an activist for prison reform. And I have to be honest and transparent on this call. I don't agree with the new jail. There's a lot of things that the communities are not aware of what goes on behind the scenes. And I will be that voice in Whatcom County to share my experience. My husband is actually incarcerated right now in the Department of Corrections. And one of the things I have not heard from anybody on this call today is trauma. And it not only is in the communities, but it's actually spreading to, I believe, and I say this with, I hope that you guys hear this, I'm no different than any of you. I'm equal to all of you. I may not have a degree or anything like that, but I live this experience. And I can tell you in the last 6 years, I have now gained anxiety and depression due to the treatment that I've been treated as a family member of an incarcerated individual. What needs to be looked at is, in my eyes, and this is just guidance or words to all of you, is that the treatment within the facilities needs to be looked at. The treatment on how we as families are treated needs to be looked at. Punishment really needs to go away. I know for me that I was abused. I was an abused child, and to continue to have that treatment from others that have no authority over you is hard. And I will be attending these. I actually will be sitting in that conference room. I hope to get to know all of you. One day I might be actually running for council. I'm very involved in the legislation. FOTI has actually created our own initiative this year. We are fighting for visitation rights, not only in the prisons, but as well as in the jails. So we are all over the place. And we found that we have families in every single district. So I hope that we are heard and valued at this table, and we're not here to rustle any feathers at all. And I believe I've actually spoken with you, Caleb, on the phone several months ago. But we are here to be a part of the solution for a better Washington. So thank you for, one thing that I would like to make a suggestion though, I am somebody, I would love for you guys to see my face. So if there was any way that we could open up the video too, that would be awesome. But I will be here every meeting.
Thank you, Keilani. And if this helps a little bit, know there is learned experience here. For example, I'm the co-chair. I've got a DOC number. I was sentenced to 5 years back in the 80s and served about a year of that. And there are others here that have that learned experience as well. So we're not simply people with degrees that have never been in the system. So I hope that helps you feel some comfort that the perspective of people with lived experience is present in this group. And yeah, I hope that helps.
Thank you, Keilani. The next person who with our hand raised is Andy Douglas. Andy, if you'd like to go ahead and speak.
Hi, I strongly agree with the two previous speakers, but my point is that I was very concerned and upset with the statements by Scott Carthice and Jack Hovner about not letting the public know where you plan to situate the jail and not having that as part of the whole system and the size of the jail as well. That seems to be a decrease in transparency in government and would limit citizen input greatly. And it will, I mean, the public already doesn't trust you on the jail issue. That's been clear. And that would decrease our trust in you. And of course, just like the two previous speakers, I think your task force is greatly lacking in diversity. It's what John Oliver would call the pale male constituency.
I agree.
Yeah, and we really need to work on that. Why would you have a task force that is developing policy towards a group that's not represented on that committee? That is terrible, and behavioral health does not fix that. They have been found to be sexist and racist in studies of members of their organizations. And I have a degree in counseling, and I found that in my counseling school, that there was a great deal of sexism and racism. So I really think that this is something where there's a big blind spot on this committee that could be worked on. This, and it's a cultural thing. It's something we all share. It's not on you guys so much as it's a problem in our culture that we really need to work on. So again, my first point is transparency, and the second is more diversity. Thank you.
Thank you, Andy. And the last person whose hand's raised is Josh. Josh, if you go ahead and speak to the task force.
Hi, can you hear me?
Yes, we can hear you.
Yeah, so I just found out about this meeting on Facebook right now. This was posted 40 minutes ago. It's 10:20 right now. So that means 9:40 it was posted. So, and the meeting started at 9, correct? Okay, so there seems to be a lack of transparency there. Like, why would you post, hey, we're going to have this meeting after it already started? You know, I think that could definitely, I don't understand that. You know, it seems like you don't want people showing up to this meeting. Because there's a lot of people that they're not satisfied with this, not incarcerating people. We have a ton of book and releasing for so many crimes in Bellingham, open drug usage. Bellingham is not family friendly now. So also too, I'd like to speak to there's a lot of people with lived experience on, you know, the other end of, you know, where they were grateful to be incarcerated, to be able to, you know, get sober and have some clarity. And we need those voices in on these conversations as well. So yeah, it's Bellingham's just gone way downhill. We need to hold people accountable for their actions. Also, I don't think we should be, you know, group identity. Andy was talking about group identity, and I don't think that those hold any merit, and we need to look at stuff on, you know, for individuals. So yeah, I'm just hopping on here last minute, but you guys need to be more transparent when you're having these meetings so the community knows, what's going on. So yeah, I haven't really had a whole lot of time to like write my thoughts down and stuff, but I just figured I'd hop on and communicate because Bellingham it's not safe, and parents can't have their kids walking down to a gas station without getting offered drugs. There's needles everywhere. Also, too, there's stuff that's going to be. Have you heard of tranq or benzodope? Has anyone heard of that? Yeah. So these people are so addicted and they won't stop using it. Here they have toes, fingers, arms, legs having to be amputated. They're like, look up Kensington, Pennsylvania, I believe is where it's at. Like it's rampant over there. Is that compassionate to let someone live out on the streets and continually use, and they're so addicted that they can't get off this drug and they're literally losing limbs? How is that compassion? And I get, hey, I'm all for services. Let's get services in a carceral setting. What would an ideal jail look like? Let's get a conversation going about that. Because if these people are just allowed to, and we're just enabling them to continue to use, and they're so addicted, they're literally losing limbs instead of getting help, I don't think that's compassionate. That's not compassionate. So, and I'm saying this because I care about those people. I don't, and here's the thing too, I don't want people locked up forever. I want them to just get separated, get some clarity, get sober. What do they need for help? Let's give them services in an carceral setting. So I find that, this not incarcerating people, it's harming not only the community, but the very people we're trying to help. And there's a lot of people with lived experience who would agree with that as well. So we need to get those voices in here too. So that's all I'm going to go with for now.
A couple things, and I think in our next steering committee, Stephen, we may want to talk about how we have, like, I'm going to call on the two task force members with their hands up at how we deal with that going forward to public comment. For Josh's and the task force's overall information, very good point. That meeting should have been posted sooner. I will say this is a brand new thing. We just approved the graphics. I think it was last Friday, Stephen. And I think what probably happened is Pyramid, the company doing this, came in and posted that when they came into work on Monday morning, not realizing the tardiness of that. So we will communicate with them, Josh, thank you, to make sure that doesn't happen in the future. That wasn't intentional. And for your information and others, all of our meetings are publicly noticed on the county website and have been well in advance ever since we started. But certainly that appearance of saying a meeting started 40 minutes after is not a good practice, and we'll make sure that doesn't happen again. Sorry about that. Danelle and then Deborah.
Yes, I just want to verify that the meeting on Facebook and social media was actually posted over the weekend. What he saw 40 earlier this morning was a repost. So it was on there this weekend. So yeah, thank you.
Great. I didn't realize it. I just followed. Thank you. Thank you.
Yes.
Deborah?
Yes, I just wanted to say to those that have spoken from the public, first of all, ironically, I got to meet online relatively recently the second woman who spoke from FOTI, Families of the Incarcerated, and I know her as Matt Leaney, but sorry, Matt Leaney, I know that you put up a different name there. But anyway, what I'm trying to say is that I have very much lived experience as a person who has an incarcerated son who has spent a total of 19 years out of, he has spent 20 years incarcerated. I'll say this a different way, 20 years incarcerated with a total of 1 year being out. These incarcerations include him entering his 4th prison sentence. He's currently in Whatcom County Jail with those charges, and just tons of incarcerations in jail, Whatcom County Jail and other jails around the state of Washington. So I wanted those that were doing public comment to know that I actually was going to get a hold of Matt Leaney again this morning and see if we could meet. We've been trying to get together, and I have another son who has turned his life around dramatically and is very, very successful. But quite a few years ago, he was also in the system. So I guess I want to just end this rambling and say that I have extensive lived experience with loved ones, my two sons in the system, going all the way back to being in Whatcom County Courthouse on a weekly basis, of which people like Eric Ritchie could attest to, starting with juvenile, in the juvenile criminal justice system, both of my sons, all the way to here. And my sons were 16 and 18, or excuse me, 16, 17 at the time. I could go on and on for a long time of all the things that my kids have been involved in Whatcom County. And now my older son, unfortunately, has followed down the path of incarceration. So I just wanted to get that out there. And I have a lot more comments to make to the task force members themselves that I have been reserving, but want to be more of an active contributor given my background. Thank you.
Thank you. Jill, have we heard from everyone?
Yes, I believe we've heard from everyone. And so Stephen and Mike, I've got a quick question for you after the meeting. Thank you.
Okay, great. All right. Thank you, everyone. We appreciate you being here, and thanks for your efforts and work. And we will see you next month or in our subcommittees as we go forward. And thanks to the individuals who've come to listen to our meeting and give us input. We appreciate hearing it. And with that, this meeting is adjourned.